California becomes the first state to offer health insurance to all undocumented immigrants. Starting January 1st, California will offer health insurance through Medi-Cal to all undocumented immigrants, regardless of age. Their expansion will make approximately 700,000 undocumented residents between ages 26 to 49 eligible for full coverage. California has gradually expanded health coverage for undocumented immigrants over the years, starting with children in 2015 and expanding access to young adults 19 to 25 in 2019. The state views this expansion as commitment to healthcare as human right. While there have been concerns about the strain on the Medi-Cal system and provider access issues, studies have shown that undocumented immigrants use fewer healthcare resources than non-immigrants. Tom, thoughts on this with California?
There's a couple things going on here, and people need to hear the truth. This is a campaign slogan coming out of the mouth of Gavin Newsom. They have been providing healthcare coverage to undocumented immigrants for years. There have been major hospitals, and Pat and I come from LA, so we know a little bit about LA, well covered in the LA Times, well known down there. King Drew Medical Center, which is now closed, has been replaced by MLK. Downtown hospital providing critical care to people that come in from everything from an overdose to a undocumented immigrant who's trying to get, some care and coverage for a child with pneumonia, and they're not turned away. And instead, what happens is that was provided under Medi-Cal, which is basically Medicaid in California is called Medi-Cal. It's, Medicaid. We all know what that is. That's basically healthcare provided to people who are in poverty or too poor to afford it. And so what's happening now, we're just going to give you health insurance officially through Medi-Cal. But it was already being covered by the state because the hospitals didn't turn them away. But what the state has done to the hospitals is turn down what they're willing to pay for the service. Oh, an x-ray, we're only going to give you $11 for that. And what happens is when the state says, okay, you're all getting healthcare coverage. Yay, if I'm an undocumented person, my kid breaks his ankle playing soccer, he can go to a hospital and get coverage. That on the human side is good. Right? Now, it's not good that they're undocumented and hear other stories there. But now the hospital's told, you get $11 for the x-ray and $54 to put the bone back and then give you $75 for the cast. The hospital looks at it. It cost me $305 just to have them walk in this place. And I'm going to get $175 back. And if you scan down, here is an article from the LA Times about MLA Hospital says, it could soon be unable to pay its bills. Why? Go to paragraph number 4. Here we go. 1, 2, 3. One of the biggest challenges is the fact that emergency department has been deluged. Deluge means flood, overwhelmed. Thank you. With 4 times as many patients as initially expected. That's a problem because, wait. Here it comes. How are we giving the undocumented health insurance through? Medi-Cal. Here comes Medi-Cal, because Medi-Cal, the California Medicaid program, does not fully cover the cost of providing emergency services. So Gavin Newsom is bankrupting his own hospitals for the sake of a headline to look good to the voting bloc.
Are you kidding me, Tom?
I'm out.
So how do you do this? And so I'm a hospital owner. I own a hospital. Okay, I come back and say, hey, dude, what are you doing?
You own a hospital with a permit in California, and I will not sign your permit unless you take Medi-Cal and you take.
How do you expect me to stay profitable, Gavin?
I don't care. If you want your permit, Mr. Bet David, sign here.
But how do I stay in business?
That's not my problem, Mr. Bet David. I will pay you this much for the services.
Then if that's the case, I think the hospitals are going to come together and they're going to say, you're out of your mind. They're going to have a conversation with them to say, you want us to shut down hospitals?
King Drew went out of business and was replaced by MLK Hospital, a major hospital in the shadow of USC, in the shadow of UCLA. Big medical schools went out of freaking business and was replaced by MLK Hospital.
I used to think that SoCal, it stood for Southern California, but it's become clearer and clearer that it stands for Socialist California. I used to get
California.
Yeah, exactly. I used to get in arguments with our friend Ricky, and he'd be like, "Oh, the Democrats, bro," and I was like, "Yeah, I don't see that in Florida at all. You know how it is here. Like, most people are pretty moderate here in Florida." And I didn't really understand the deep divergence of how left and right people in California, there's a deep divide there. Because the socialist programs that have basically come in California, as Ricky calls it, is so palpable that just doesn't exist here in Florida. That why Ricky and I would always argue. I'll be like, why do you hate the Democrats so much? Because I see what's going on in California with the trans stuff, the socialist stuff, and now the medical stuff that's going on here. Where in Florida that doesn't exist. As Ron DeSantis says, Florida is where woke goes to die. California was where woke goes to live. Okay?
Yeah, right.
Survive what's going on there. Everything that DeSantis did with basically the trans stuff and basically the commercials, we all know what happened right there. But when it comes to healthcare, obviously one of the biggest issues, Obamacare, Trump, John McCain, the thumbs down. Yeah. We all know what happened there. But, the question of whether healthcare is a right or a privilege, still unanswered. But what we do know on that is this, that government-run healthcare is a recipe for disaster. Talk to anybody in Canada that wants some good treatment. Like, it's a disaster out there. Talk to anybody that runs with, get the government out of my bedroom, get the government out of my hospital room, anything that goes on with that. Universal healthcare would be a disaster. I didn't fully understand that situation from a national perspective, but let's look at California as a case example to see what happens.
You got to keep your voters healthy, though. That's why he's doing it too.
Private companies compete.
You got to keep your voters healthy.
No, but listen, I said this jokingly earlier, but it's exactly what it is. So imagine if all of a sudden Apple started giving non-employees ID cards to enter the building.
They're going to eat everything.
So think about what I just said.
Yeah.
Hey, moving forward, Apple, a publicly held company, $3 trillion company, give or take, we're going to offer everybody in Cupertino an ID to come into our cafeteria, whether you're an employee or not. Tell me logically how that makes any sense. Purely logically. It doesn't make any sense.
That's a perfect example.
What do you mean you're going to offer immigrants who are not here legally the same benefits of the people that work to come here legally? Tell me how that ID card makes any sense. Mm-hmm. What is the big deal of me being a California resident? So if that doesn't work for a company, how does that work for a state? Well, those are two different things. How are they two different things? Who's still paying for it? Somebody has to pay for it. They're not coming here spending the money. Who's paying for it?
You.
I'm paying for it. You and I are paying for it.
Yeah.
But Pat, where's your empathy? Where's your heart? But that's what I'm saying. That's the argument.
But here's my thing, though, and you just made a great point. The people of California are going to do nothing about it. What, you're just going to sit on your hands and not do shit? That's the people's responsibility to say, hell no, yeah, he's the governor. He makes the final decision. Where are the people at? You should be, California should be lining up, not for a climate protest and we're going to stay in the road because, the whales are dying. No, get in the goddamn streets, sorry, that's the Lord's name in vain, and fight for, are you crazy? I'm paying for somebody that doesn't belong in the country.
But let me give you the good news at the very least. The good news is this. If you look at what's going on our border, no one's coming across. There's no caravans of people basically
invading,
running. That doesn't exist. It's
Let me
not
go
a
into
problem.
that story, actually.
Yeah.
So why are we even worried about something like this, guys? Drop it.
Let's put this right at the end. And ladies and gentlemen, if you're not voting, you're an idiot, because when that hospital closes, that emergency room is not available for you with full health insurance and a credit card to pay the deductible.
Bingo.
Either.
So if you like this clip and you want to watch another one, click right here. And if you want to watch the entire podcast, click right here.